Welcome back, and as we earlier said, we're going to be talking about digital transformation, and digitalizing our lives came and was speeded up by coincidence, and with coronavirus it had speeded up our digital life. Egypt is making several key investments in the area of health technology and reducing costs and provide efficient care to its people. And COVID-19, of course, as we all know, have speeded up the digital transformation and increased the use of remote monitoring, telehealth, and artificial intelligence, of course, enabled apps and devices and several things like that to be able to monitor the health system. The government is driving digitalization across the sectors and has been pushing for universal healthcare and cross-industry collaborations. To shed more light, we're very delighted to be having with us here live in the studio our prominent guest, Dr. Nevine Makram Labib, and she's head of Computer and Information System Department. Good morning, Dr. Labib.
Good morning.
How are you doing?
Fine.
Let us first explain to our viewers what is meant by digital transformation, being in the sense of empowering and enabling the systems, the governmental systems.
Actually, it's just transforming the actual processes or inventing new ones using digital technologies. Okay, so you can think about it, let's say, using hardware, software, the actual data, the patient data that's already there, if we're talking about the healthcare systems. Using some digital transformation, some digital technologies such as the telemedicine, the big data, the Internet of Things, and many other of the trends that have been accelerated after the coronavirus.
Of course, we all know that the digital transformation that is introduced to the health system worldwide is very efficient compared to any other system. I mean, to the e-banking, to the distance learning, and we know that all of these sectors have been digitalized. But when it comes to the health system, it could become the backbone and could speed up lots and lots and lots of formulas or plans to be able to empower the system. How can we do that?
Actually, we've been working on digitizing the medical services because that's a prerequisite for digital transformation. By digitizing, we're talking about doing everything in a digital way, working on the actual patient data and making it digital, not analog, not using it in a manual way. So that's number one as a step. And then number two, we have to work on having talented people, or let's say the competent people that will be able to invent or to work with these systems to make use, at least as an end user of the system, and changing the culture of the organizations or of the medical institutions themselves. That's a very important aspect. So you can see it, for example, like having 3 dimensions: the processes, the culture, and embedding technology into these institutions.
This has to also to train doctors on how to be oriented with the digital process, or we have to bring experts, digital experts that has, I mean, that's totally separate from the medical team.
Okay, the experts will work on the systems, on creating and on developing these systems.
Programming the whole thing.
Exactly. As for the doctors, any physician, any nurse, any stakeholder in this system or super system, they have to be trained on just using the system. We're aiming at, including some of the data in order to get some insights. And these insights are presented in the form of reports to the different decision makers in order to take suitable decision that will make things easier for the patients. We're working on a patient-centric applications.
Before we delve into details, could you tell us what are the 4 main areas of digital transformation generally?
It's not only 4 areas, you have different approaches. Let's say if you're going to use an approach that's focusing on the 3 dimensions that I just mentioned, so you'll be focusing on what we call the process re-engineering. That's kind of checking the actual processes in order to decide whether these processes are necessary or required, or whether you can just eliminate them and work on the rest and digitize them. That's number 1. Number 2, working on kind of an awareness campaign in order to explain to the different stakeholders what digital transformation is, what's in it for them, why should they go and use it, why don't they keep the actual systems. Okay, that's another thing. And the third dimension is working on the IT infrastructure, working on having a secure network, because you need to secure this information. That's a very important point, and that's a debate. Whether
Like any other data, it has to be...
Exactly, but that's more important, because as you know that humans are the most important asset in any country. So you have to work on securing this data, on working on making use of different software, different secure systems, okay? Working on the access privileges. Who is allowed to see which data, why and how. Okay, that's the third dimension. So you may apply this approach. That's what we've been working on here in Egypt. You know, the Minister of Health in last February has been talking about the digitization of the actual medical services as a prerequisite to apply digital transformation in Egypt. And we have started in 2019. That's stage 1, working on some governorates. Right now we have this digital transformation in Luxor, in Port Said and Ismailia as a trial. And you've been seeing many initiatives, like for example the 100 million Saha. That was very beneficial, and that was very, you know, it was needed at this time, especially with the coronavirus.
It seems that digital transformation started off with monitoring numbers and monitoring locations, especially with initiatives and campaigns, and health campaigns, and it has profoundly succeeded with 100 million lives and the other campaign for women, and it has extended also outside Egypt, all over some brotherly countries in Africa, when Egypt was assuming the African Union. So speaking about COVID-19, of course, we need to stand up to this very dangerous pandemic, and it's sarcastic that this pandemic, we have benefited from that pandemic by speeding up digital life. How do you see that?
It accelerated the use of digital transformation, because before coronavirus, many people thought that this is kind of a luxury, whereas it's not a luxury. Okay,
they were not ready enough.
They were not ready, and you know, we always say that the cultural change is a main issue. Okay, so for us, we like to go and visit the doctor and to have this one-to-one communication, the face-to-face communication, and this was not available with the coronavirus. So people thought at this time that they can make use of other alternatives, and that's how we started applying the digital transformation and started focusing more. Although we had already started in 2019, but this accelerated the use and the implementation of different systems. Because, for example, you could not go and visit your doctor. So with the telemedicine apps, you were able to do it. You were able to have kind of a virtual appointment with your doctor.
Really?
Yes.
And can I get an accurate diagnosis through the, an online diagnosis?
It was kind of a face-to-face using digital technologies. But as you know, you didn't have any other
can we dream one day of that?
It's already there. For example, let's take the example of the coronavirus. Last year, you had many apps that was, kind of helping to diagnose if it's coronavirus or if it's just flu, and then transfer this case to a teleconsultation, so that the patient is able to communicate with his doctor, his or her doctor, using this app. That's already there. It might not be, it might not be 100% accurate, because you still need to see the doctor in person, but that was the only alternative, the only solution.
In some areas, of course. And when there could be, there isn't enough doctors, or in some chronic cases, or in some emergency cases, it could be excellent. But in some other cases, it could be impossible. In some other medical cases, can I apply digital checkups and diagnosis on all medical cases? Could that happen one day?
It's already there, but it needs some requirements. You need to work on a proper IT infrastructure. You need to work on the cultural issues. You need to have a secure system. You need to have a very good network. So there are some requirements. If they're there, you can apply digital transformation and digital technologies in each and every domain. Like for the telesurgery, for example, you can make use of robotics.
Of course. We have seen telesurgery.
Yes.
And
one of
we
the
have
trends.
seen yes, and it has been on for too many years. But diagnosing, still we need the human element to be able to diagnose and examine perfectly the human body to be able to come up with the right diagnosis. But hopefully with this advent with technology, hopefully one day that we could be able to do that.
As I'm
through
just
technology.
mentioning that it's already there using what we call the virtual reality, for example. So it's not a substitute to visiting or to being examined by a medical doctor, but it's another way to see it. It's another way to perform the task. That's what digital transformation is. With the artificial intelligence apps, as you just mentioned, again, it's the same story. Because with AI, you're trying to mimic or you're trying to do the same tasks that are usually performed by humans using the human intelligence. So we're trying to transfer.
And much more safe.
It is safer. And as I just told you, sometimes it's the only alternative that you have, especially with the pandemic.
Right, but doing so and reaching to that point where you can completely examine a human body or a patient through a robot. So do you think that what does it require from both ends? The medical part and the technological team also. I mean the medical team and the technological. You need enough medical information. You need to collaborate with specialized doctors. Do you need to be oriented with medical information enough so that you can feed this technological system in order to be able to reach whatever target you are planning to reach?
Okay, let's perceive it as a project. So in order to implement this project, you have to kind of do a cooperation or a collaboration between the two sides, the medical and the IT professionals. So for example, for us as IT professionals, we have to study how medical doctors think, what are their needs, what are their requirements, the terms used. That's what we usually do in any field, that we need to apply IT in it.
The details.
Yes, the details. And for the other part, for the medical team, they have to understand what is digital transformation, what about the different digital technologies. We have to explain to them that we're not substituting them, we're just helping and supporting them to perform their tasks in a better and more efficient way. So you need to work on these sides, first of all. And then we need to work on some templates for the data, because one of the problems we have is that we don't have a certain template. So if you want to go into integration, if you want to see the files in a comprehensive way, just to see it from the country's point of view, on a national level, you've got to have a template so that when it is filled in each and every institution, health institution, then you can get some insights out of it. Or else you're just left with some data that are not really useful, that are not updated. We call it noisy data. You have data,
noisy
but
data.
Yes, it is noisy data because it's not accurate, it's not complete, it's not updated, it's not documented. So you cannot really rely on these data.
So whose fault is it going to be? The people who provided you with the information, or the people who did not work enough?
No, the problem is that we don't have a system. You need to establish a system that will include some templates, and you need to enforce all of the people, all of the stakeholders in the different institutions to make use of these templates in order to have kind of a comprehensive view and to give it to the leaders so that they can take suitable decisions. Requiring, for example, how many hospitals do we need? What about the equipment? What about the efficiency and effectiveness of each and every treatment and medicine? You're investing in people's lives, and that's #1 priority, especially in our country.
But that's another sector. There are too many sectors, it seems. But talking about still the diagnosis and the examination and the treatment, and inside the hospitals, and in times of crisis like the pandemic, like the third strain, like combating the evolution of the strains from time to time, this would definitely need technologies. Have you prepared something for that? I mean, are you working?
Yes,
currently?
there are already many apps that are doing with the early detection of many diseases, and they had kind of an early detection for this pandemic, and for the treatment, for the diagnosis, for what we call the prognosis. What if the person takes or the patient takes a certain treatment? What will happen after? Kind of predicting That's why we're making use mainly of two sides or two dimensions, the telemedicine and the data analytics, the big data. Of course, you've been hearing about this term lately a lot. So what's big data? It's having not only a huge amounts of data, but this data has many dimensions, so that again you can have some insights out of it and get prepared. We're talking about some strategic planning for the country. Okay. With the pandemic, you had to plan, you had to work on having some hospitals, you had to work on providing
in order
some
to avoid the
medicines.
bad experiences that are happening in some countries like India, for example.
Exactly. And thank God we've been able to handle it.
We have been.
Yes.
We're doing perfectly well compared, thanks to God, compared to other countries.
Exactly.
Developed countries also. But also learning from the past experiences of COVID-19. Like for example, in England, there weren't enough hospitals, there weren't enough places, there weren't enough doctors when it was really intense. So I guess this would help a lot in the future experiences. And this is what's helping us now, not only in England, I mean in other countries. Okay. So how have we benefited from the previous experiences to make the best use and try to avoid mistakes to happen?
Okay, we've been working on some joint projects, joint research projects, in order to get to know the risk factors, in order to get to know what...
This is very important, by the way.
Yes, and you could not do it without the artificial intelligence, because you've been collecting...
Exactly.
Yes, you've been collecting...
That's the main goal here.
Yeah, that's the main point. Making use of AI in order to discover or to uncover some of the patterns. How do we do it? We just collect data, but not noisy ones, of course. We try to work on good data, and then applying some of the software and doing what we call predictive analytics. So with predictive analytics, you've got some insights, even if it's not certain 100%, but it can lead you on taking some suitable decisions, not waiting till you have a disaster. You can get prepared.
And taking the right decisions also, based on
we call it the
experience.
suitable, not the right. We prefer in the decision-making process whenever it comes to IT, because it's not 100%. So you will never know if it's right or wrong unless you're taking the decision, you know, after the consequences, after implementing the decisions. And then you can evaluate using some indicators if that was the right or wrong. And sometimes it's not totally right, but it's suitable. Because you have to take many aspects, for example, the economic aspects into consideration. So you cannot go and do it right 100% if it's going to affect other aspects in life. It's very much complicated.
For people, normal people like us who are observing this huge development in that particular sector, we would think I'm really not a professional with technology. But at the same time, I would think, gee, this particular sector, or introducing technology to the medical field or the medical institution, would help humanity in cases of, for example, wars, or in cases of huge emergencies or intense emergencies, in cases of when things get worse in pandemics, and it always happens with the climate change and everything. When there is not enough hospitals and people need to be nursed at home, then technology would come in at that time. How is that going to happen? How do you imagine, as an expert, this is going to happen?
Again, it's already there. But for us in Egypt, you need to establish a system so that this system can embed implementing telemedicine, implementing what we call the IoT, the Internet of Things.
IoT.
Being linked, being
what
linked with a kind of a network for devices. And sometimes we have what we call IoE, that's the Internet of Everything, that's being linked with people. Not only the things, but the people. So for example, for some doctors, they were able to make kind of a follow-up for their patients using some sensors. And with these sensors, they were able to give them the proper treatment or proper advice over the phone. That's already there. You have many trends that have been applied last year and this year, thanks to the pandemic.
Yes, that's very right.
We have to transform the way we provide medical services for the patients. Okay, that was a must. You didn't really have a choice. So you made use of this IoT, you made use of telemedicine, of what we call chatbots. You can have a chat with an app on your mobile, and this chatbot was able to kind of do a differential diagnosis, so that can help if it's really, or if it can be a coronavirus or not, and then handing this with the medical doctor. So I have many trends that have proved to be very beneficial. What we need to work on is a system. If you establish a system so that you have proper data.
An organization.
Exactly.
Unfortunately, we ran out of time, but very encouraging and amazing news that would enlighten us in that really very gloomy days worldwide. We hate to end it here, but unfortunately we have to, on a promise that you would come later on,
Inshallah,
in the coming weeks to give us more information and explain more. Thank you so much, Dr. Nevine Makram Labib, you're head of the Computer and Information System Department. Thank you so much.
Thanks, dear.
And you have a beautiful day.
You
and
too.
We're going to go to a short break, and we'll come to continue the breakfast show, so stay with us.